Muhammad Ali, one of the greatest boxers the world has ever seen, died at the age of 74 from septic shock. This was a man who survived some of the most brutal fights in sporting history, a man known across the world as the greatest, a man who stood in the ring against some of the strongest opponents of his generation. But in the end, what took his life was not another boxer, it was septic shock. His official cause of death was reported as septic shock due to unspecified natural causes. He had been admitted to hospital after developing respiratory problems, but the exact source of the infection was not publicly revealed. And that is one of the frightening things about sepsis. Sometimes the infection source is obvious. Sometimes it begins with pneumonia, and sometimes, even in hospital, the exact source is not immediately clear. But what matters is this: sepsis can affect anyone. It can affect the elderly. It can affect people with long-term medical conditions. It can affect people after surgery. It can affect people with weakened immune systems. And sometimes it can affect people who were previously fit and well. So in this video, I want to explain in simple terms what sepsis is, what septic shock means, where these infections can come from, what warning signs you must never ignore, and most importantly, what you can do to reduce the risk of this happening to you or someone you love. Because sepsis is not just another infection. Sepsis is a medical emergency, and recognizing it early can save a life. As a doctor, I've seen how quickly sepsis can change someone's condition. A person can look reasonably well in the morning, then by the evening they are confused, breathless, their blood pressure is dropping, their kidneys are struggling, and the family is asking, how did this happen so fast? That is why awareness matters. So let's start with the most important question. What actually is sepsis? Sepsis happens when your body has an extreme and dangerous response to an infection. Normally, when you get an infection, your immune system responds in a controlled way. It sends signals, activates white blood cells, raises your temperature, and tries to fight the bacteria, virus, or other organism causing the problem. Most of the time, this response is helpful. You may feel unwell for a few days, then you recover. But in sepsis, the body's response becomes uncontrolled. Instead of simply fighting the infection, the immune system begins to damage the body's own tissues and organs. Blood vessels become leaky. Blood pressure can fall. The heart has to work harder. The lungs may struggle to get enough oxygen into the blood. The kidneys may stop filtering properly. The brain may become affected, causing confusion or drowsiness. The liver may become strained. The blood clotting system can become abnormal. And this can all happen because the body has gone into an overwhelming emergency response. So sepsis is not just an infection in the blood. That is a common misunderstanding. Some people with sepsis do have bacteria in the bloodstream, but others may have sepsis from an infection in the lungs, urine, skin, abdomen, or elsewhere, even if blood cultures do not grow anything. The key point is this: sepsis is when an infection triggers a dangerous whole-body response that starts affecting the organs. Now, the next question is, what is septic shock? Septic shock is the most severe form of sepsis. This is when the infection and the body's response become so serious that the blood pressure drops dangerously low, the circulation starts to fail, and the organs are not getting enough blood and oxygen. Think of your bloodstream like a delivery network. Every organ depends on that network. The brain needs oxygen. The kidneys need blood flow. The heart muscle needs oxygen. The liver needs circulation. The skin, muscles, gut, and every cell in the body depend on a steady supply. In septic shock, that delivery system begins to collapse. Blood vessels widen. Fluid leaks out of the circulation. The heart may struggle to keep up. Blood pressure falls, and organs begin to fail. This is why septic shock is so dangerous. Patients with septic shock often need intensive care. They may need oxygen, intravenous antibiotics, fluids through a drip, medications to raise blood pressure, close monitoring, and sometimes breathing support or kidney support. It becomes a race against time. And this is why, when doctors suspect sepsis, we do not wait casually to see how things go. We act, because every hour matters. Now, one of the reasons sepsis is so dangerous is that it often begins with infections that sound ordinary. Let's go through the common sources. The first major source is the lungs. Pneumonia is one of the most common infections that can lead to sepsis. This may start with a cough, fever, shortness of breath, chest pain, or feeling extremely weak. But in older adults, pneumonia can sometimes present differently. An elderly person may not complain much of cough. They may not have a very high temperature. Instead, they may become confused, sleepy, off their food, unsteady, or just not themselves. Families sometimes say, they were fine yesterday, but today they seem completely different. That change can be a warning sign. The second common source is the urinary tract. A urine infection can sometimes progress to sepsis, especially in older adults, people with diabetes, people with kidney problems, people with catheters, or men with prostate problems who cannot empty the bladder properly. A simple urine infection might cause burning when passing urine, needing to pass urine more often, lower tummy pain, fever, or back pain. But again, in older or frail people, the signs may be less obvious. They may become confused, they may fall, they may become very weak, they may stop eating and drinking, they may become incontinent when they are not usually incontinent. And if the infection spreads or triggers a whole body response, it can become sepsis. The third source is the skin. This can be cellulitis, an infected wound, a pressure sore, an infected ulcer, or an infection after surgery. A small area of redness can become hot, painful, swollen, and spreading. There may be pus, there may be red streaks. The person may start shivering. They may feel extremely unwell. And if the infection enters deeper tissues or triggers sepsis, it can become life-threatening. This is particularly important for people with diabetes, poor circulation, reduced mobility, leg ulcers, or wounds that are slow to heal. The fourth source is the abdomen. Abdominal infections can include appendicitis, gallbladder infection, diverticulitis, bowel infection, bowel perforation, or infection around the liver or bile ducts. These can be dangerous because the infection may be deep inside the body. Symptoms may include abdominal pain, vomiting, diarrhea, fever, bloating, collapse, or feeling severely unwell. Sometimes the pain is obvious. Sometimes, particularly in older adults, the signs are surprisingly subtle. The fifth source is dental infection. Many people underestimate dental infections. Most dental infections do not cause sepsis, but a severe untreated dental infection can occasionally spread and become dangerous. Facial swelling, fever, difficulty swallowing, worsening pain, or feeling very unwell should never be ignored. The sixth source is infection related to medical devices. This includes urinary catheters, intravenous lines, feeding tubes, surgical wounds, joint replacements, and other medical implants or devices. These are sometimes necessary and life-saving, but they can also create a route for infection if not carefully monitored. So when we talk about sepsis, we are not talking about one single disease from one single source. We are talking about a dangerous response that can happen after many different types of infection. Now let me give you a simple example. Imagine an older man called David. David is 78. He lives at home with his wife. He has diabetes and mild kidney disease, but he is usually independent. One day, he starts passing urine more often. It burns slightly. He thinks, I'll just drink more water. The next day, he feels tired. His wife notices he is quieter than usual. By the evening, he is shivering, but he says he is just cold. Overnight, he becomes confused. He tries to get out of bed and nearly falls. In the morning, his wife notices he has barely passed any urine. He looks pale, his hands feel cold. He is breathing faster than normal. He cannot explain what day it is. At this point, this is no longer just a urine infection. This could be sepsis. And the right action is not to wait another day. The right action is urgent medical assessment. Because if sepsis is treated early, people can recover. But if sepsis is missed, it can progress to septic shock, organ failure, and death. Now, let's talk about symptoms. This is the part one really want you to remember. Sepsis can look different in different people. Not everyone has every symptom. Not everyone has a fever. In fact, some people, especially older adults, may have a low temperature instead of a high one. Some may simply become confused, sleepy, or unusually weak. But there are warning signs that should make you seek urgent help. Severe breathlessness, breathing much faster than normal, confusion, slurred speech, extreme shivering, severe muscle pain, skin that looks pale, blue, gray, mottled, or blotchy, feeling cold and clammy, a very high or very low temperature, passing very little urine, feeling dizzy, faint, or like you may collapse, a racing heart, severe weakness, a rash that does not fade when pressed, or a sense that something is seriously wrong. And I want to say this clearly. You do not need to diagnose sepsis yourself. That is not your job. Your job is to recognize when someone is much more unwell than expected and to get urgent medical help. If someone has an infection and they are becoming confused, breathless, very drowsy, mottled, not passing urine, or rapidly deteriorating, do not wait. One of the most dangerous phrases in medicine is let's just see how they are tomorrow. Sometimes that is reasonable for mild illness, but not when someone is rapidly getting worse, not when they are confused, not when they are breathless, not when they are not passing urine, not when they look mottled or blue, not when they feel cold, clammy, and severely unwell. Now, who is at higher risk? Sepsis can affect anyone, but certain groups are more vulnerable. People over 65, babies and young children, pregnant women, or those who have recently given birth, people with diabetes, people with cancer, people receiving chemotherapy, people on long-term steroids or immune-suppressing medicines, people with chronic kidney disease, people with liver disease, people with severe lung disease, people with frailty or dementia, people with poor mobility or pressure sores, people with urinary catheters, people who have recently had surgery, people with wounds, ulcers, or medical devices, and people who have had sepsis before. But here is the important point. You do not need to be in one of these groups to develop sepsis. Being young or fit does not make you completely immune. That is why awareness is important for everyone. Now, what happens when someone arrives in hospital with suspected sepsis? The first priority is to assess how unwell they are. Doctors and nurses will check temperature, heart rate, breathing rate, blood pressure, oxygen levels, mental state, urine output, and blood tests. They may check infection markers, kidney function, liver function, blood clotting, and lactate. Lactate is a blood test that can rise when the body's tissues are under stress and not getting enough oxygen delivery. They may take blood cultures before antibiotics, if this can be done without delaying treatment. They may send urine samples. They may do a chest x-ray. They may arrange scans. They may start oxygen. They may give intravenous fluids. They may give antibiotics through a drip. They may monitor urine output. And if the person is very unwell, intensive care may become involved. In the UK, many hospitals use structured approaches to sepsis care, including rapid treatment bundles designed to make sure the basics are done quickly. But for the public, you do not need to remember the medical pathway. You simply need to remember this. Sepsis needs urgent hospital treatment. It is not something to sleep off. It is not something to treat with fluids alone at home. And it is not something where we want long delays. Now, can sepsis be prevented? This is an important question. The honest answer is, you cannot prevent every case of sepsis. No one can. Some infections are unpredictable. Some people become very unwell despite doing everything right. But you can reduce the risk, and you can dramatically improve the chance of survival by recognizing the signs early. So let's talk about what you can do. First, prevent infections where possible. Vaccines matter. Flu vaccination can reduce the risk of severe flu and complications. Pneumonia vaccination is recommended for certain groups, including many older adults and people with specific medical conditions. COVID vaccination may also reduce severe illness in vulnerable people. Other vaccines may be recommended depending on age, health conditions, travel, or individual risk. This does not mean vaccines prevent every infection, but reducing severe infection reduces the chance of sepsis. Second, take wound care seriously. If you have a cut, ulcer, surgical wound, or pressure sore, keep it clean and covered. Look for spreading redness, swelling, heat, increasing pain, pus, bad smell, fever, or feeling generally unwell. If you have diabetes or poor circulation, foot wounds are especially important. A small foot wound in someone with diabetes can become serious if ignored. Third, manage long-term conditions. Diabetes control matters because high blood sugar can increase infection risk and make infections harder to fight. Kidney disease, lung disease, heart disease, and liver disease can all increase vulnerability when infection occurs. Good routine care does not remove risk completely, but it gives your body a better chance. Fourth, practice good hygiene. Hand washing sounds simple, but it remains one of the most effective ways to reduce spread of infection. Wash hands before eating, after using the toilet, after coughing or sneezing, after touching wounds or dressings, before and after caring for someone who is unwell. Fifth, be careful with catheters and medical devices. If you or a loved one has a urinary catheter, ask whether it is still needed. Catheters can be necessary, but the longer they remain in place, the greater the infection risk. Look for fever, lower abdominal pain, confusion, cloudy or foul-smelling urine, or worsening weakness. Do not remove medical devices yourself unless instructed, but do ask healthcare professionals about care and ongoing need. Sixth, look after dental health. Dental infections are often left too long. Persistent dental pain, swelling, fever, or difficulty swallowing needs prompt attention. Seventh, do not ignore infections that are getting worse. This is one of the biggest messages. If you have an infection and each day you are improving, that is reassuring. But if you are getting worse, becoming weaker, more breathless, more confused, more drowsy, or unable to drink or pass urine normally, that is different. That needs medical review. Eighth, use antibiotics properly. Antibiotics are life-saving when they are needed, but they are not needed for every cough, cold, or viral infection. Taking antibiotics unnecessarily can contribute to antibiotic resistance, which makes future infections harder to treat. So the message is not take antibiotics for everything. The message is, when antibiotics are needed, take them as prescribed. Do not stop early unless advised. Do not share antibiotics, and do not delay seeking help if you are getting worse despite treatment. Now, I want to explain something that families often notice before anyone else. They say, my dad is not himself. My mum is suddenly confused. My wife is much sleepier than normal. My husband is breathing strangely. My child is not responding normally. These observations matter. You know your loved one's baseline. If someone is normally chatty and suddenly cannot hold a conversation, that matters. If someone is normally independent and suddenly cannot stand, that matters. If someone with dementia is much more confused than usual, that matters. If someone is usually passing urine and suddenly has not passed urine all day, that matters. If your instinct says something is seriously wrong, trust that instinct and seek help. Now let's address a few myths. Myth number 1, sepsis always causes a high fever. No, it does not. Some people have fever. Some have low temperature. Some older adults may not mount a strong fever at all. Myth number 2, you only get sepsis if bacteria are in the blood. No, sepsis can happen from infection in the lungs, urine, skin, abdomen, or other places. Blood cultures may be positive, but they can also be negative. Myth number 3, sepsis only happens in hospital. No, many cases start in the community before the person ever reaches hospital. Myth number 4, if I'm young and healthy, I don't need to worry. Being young and healthy lowers risk, but it does not make the risk zero. Myth number 5, if someone has sepsis, it is always obvious. Sadly, no. Sometimes the early signs are subtle. That is why education matters. Now, for a moment, let's come back to Muhammad Ali. When a famous person dies from septic shock, it shocks people because we assume something like this happens only to the very frail or the very sick. But sepsis does not care about fame. It does not care about strength. It does not care about what someone achieved in life. It is a biological emergency. And that is why we need to respect infection, not fear every minor cough, not panic every time we feel unwell, but respect the signs of deterioration. There is a balanced message here. Most infections do not become sepsis. Most coughs are not sepsis. Most urine symptoms are not septic shock. Most cuts do not become life-threatening. But when an infection is combined with rapid deterioration, confusion, breathlessness, mottled skin, very low urine output, collapse or extreme weakness, that is when you must act. As a doctor, I would rather someone seek help, and it turns out not to be sepsis, than wait at home with septic shock until it is too late. Now, what should you actually say when you seek help? You can say, I'm worried this infection is getting worse. I'm worried this could be sepsis. They are confused and not themselves. They are breathing much faster than usual. They have not passed urine. They look mottled and feel cold. They are rapidly deteriorating. Those words help communicate urgency. And if you are caring for someone vulnerable, mention their risk factors. For example, they are diabetic. They are on chemotherapy. They have a catheter. They had surgery recently. They are normally independent, but today they cannot stand. They are usually alert, but today they are confused. This helps clinicians understand the full picture quickly. Now, let's talk about recovery. Surviving sepsis is not always the end of the story. Some people recover quickly, but others experience weeks or months of fatigue, weakness, poor appetite, low mood, anxiety, memory problems, sleep problems, or reduced mobility. Some need rehabilitation. Some need follow-up for kidney injury or other organ problems. Some have psychological trauma from intensive care. So sepsis is not just about surviving the hospital admission. It can affect life afterwards. That is another reason prevention and early recognition matter. The earlier treatment begins, the better the chance of avoiding severe complications. So let's summarize the most important lessons. Sepsis is the body's dangerous response to infection. Septic shock is the most severe form, where blood pressure falls and organs can fail. The infection can start in the lungs, urine, skin, abdomen, wounds, teeth, or medical devices. Older adults may not show typical symptoms. Confusion, breathlessness, extreme weakness, mottled skin, shivering, low urine output, or rapid deterioration should never be ignored. You cannot prevent every case, but you can reduce risk through vaccination, hygiene, wound care, good control of long-term conditions, careful catheter care, dental care, and early treatment of worsening infections. And most importantly, if you are worried an infection is becoming something more serious, ask the question, could this be sepsis? Those 4 words can change the outcome. Muhammad Ali was known as the greatest. He fought in front of millions. He inspired generations. But his death from septic shock reminds us that infection can become life-threatening very quickly. The purpose of this video is not to create fear, it is to create awareness. Because awareness helps people act earlier, and acting earlier can save lives. So if you take one thing from this video, let it be this. Do not ignore sudden deterioration. Do not dismiss confusion in an older person as just age. Do not ignore breathlessness. Do not ignore mottled skin. Do not ignore someone who is becoming drowsy, cold, weak, or not passing urine. And do not be afraid to seek urgent help if something feels seriously wrong. Sepsis is treatable, but it must be recognized, it must be taken seriously, and it must be treated quickly. If this video helps even one person recognize sepsis earlier in themselves, their parent, their partner, their child, or their friend, then it may genuinely save a life. Thank you for watching. Take care of yourself. Take care of the people around you. And remember, when infection is getting worse and the person is becoming seriously unwell, ask immediately, could this be sepsis?